Hi, Ben Danielson here. I'm a pediatrician, and I'm here today to answer your questions about the COVID vaccinations for young children under 5 years old.
Do children so young really even need to get vaccinated? It seems like when they get sick, it's not as severe, they don't end up in the hospital.
This is an important one because I think it's in the back of a lot of people's minds. Do children really need this vaccine at this age? Maybe a lot of people think that children just don't get sick from the virus in the same way that adults do. Maybe they feel like this isn't necessary. Here's what I'll say to that. There are different groups of people who have more risk for serious side effects, but it does not mean that anyone is spared the potential to have a really bad time if they get sick with COVID-19. There have now been hundreds of thousands of kids who've gotten sick. There have been many kids who've needed to be hospitalized. There have been hundreds of kids, unfortunately, that have passed away from getting sick from the COVID virus itself. So despite the fact that it might be true when someone says kids don't tend to get as sick as the elderly or people with many complex medical issues, the real truth behind that is kids still get sick. They get sick in large numbers, and they can still be ending up in the hospital and having a really rough time of it. Another important thing to talk about is kids are around other people, around adults, around grandparents, around people that we all love and care about. And the potential for a kid to bring and spread the virus to other people is really also something that we need to think about from a community perspective. In a few months, there will be the start of pre-Ks and different schools and things like that, where some of the kids in this age range are going to start coming back to schools. And of course, we want them to enter the schools protected, ready to learn, and not waylaid or laid back by illness or by feeling sick on many of those important school days.